Good morning to you all. On behalf of ProColombia, we want to welcome all of you, businessmen with offices abroad and in the regional units. Today, we want to invite you to the webinar on Mega Health Works in Bogota. This is one of the most strategic pillars that the national government, together with the district government, has seen as a most interesting topic for investment companies for these large initiatives in the country. Today, I have Alfredo Rueda with me. He is the PPP manager of the Health Secretariat of Bogota. And today, he is going to tell us about these initiatives that are happening in the district. As I said before, we promote them together with our offices and with Invest in Bogota, and also all institutional entities are a part of this great initiative. It also includes the IFC as large guarantors of this process. Alfredo, thank you very much. Welcome to the session today. The floor is yours so that you can tell us about this initiative in detail. Thank you very much. Good morning and good afternoon to the people who are following us on streaming. I want to thank ProColombia and Invest in Bogota for giving us this opportunity to present our hospital projects in the city of Bogota. As a background information, maybe 20 years ago, we haven't had a project this size as the one that is taking place right now. So we are going to give you a brief summary and give you the content of our hospital projects for the city of Bogota. Just briefly, we have a fundamental issue for us, which is the diagnosis, to understand why these hospitals are required and why they're important for the city. We have some indicators. For example, the number of hospital beds in the city. We have 1.7 beds per 1,000 inhabitants, and we should be at 3.5 beds per 1,000 inhabitants, considering that in Latin America, they have 2.3 beds for every 1,000 inhabitants. So we have a deficit of hospital beds that we need to replace right now. The second characteristic is that our hospital structures are very old and they do not fulfill the seismic resistance regulations. As you know, in Colombia, especially in Bogota, we are in a high seismic risk area, and therefore we require modern institutions that are also fulfilling this regulation. The third point of diagnosis is a poor distribution of the service, of the health service offer. We have hospitals concentrated in certain areas of the area, especially in the north and the northeastern region, while in the south and the southeast, they don't have enough hospitals. So the purpose of this project is to improve the distribution of the hospital supply. And fourthly, we need to prepare for the future populational growth. This is the city that is facing huge growth in the future, and our institutions need to be prepared for that situation. It is important to tell you that in the district, we have created a structuring team led by the FDN together with the IFC to develop this project with the highest international standards. So the entity leading this team would be the National Financing Entity, FDN, which is a Colombian bank with majority participation from the Ministry of Treasury and with broad experience in the structuring of projects of this kind. As for the technical aspect, we have the company Curry and Brown in a consortium together with Isan from Peru to work on the technical scientific components and the medical and architectural components of the project. Of course, we also have the IFC, which is the co-structurer of the project, and they provide the support to the financial model and the figures managed by the different projects. We have a local lawyer firm, also with broad experience in infrastructure projects, Duran Osorio y Abogados. And in addition to that, we have other communications company like IDEA, EDP for the social components, and we also have the support of the IDB to develop the project. So we have a very complete team, a first category team, and it'll serve as guarantee of the quality of the structuring that we're working on. Our first task, together with the structuring team, would be the prioritization of hospital projects. As you can see here, we have our 6 projects that we had foreseen initially. Of these 6, we went into the second phase in the structuring of the 5 first, and the 6th project, which is La Felicidad, this is for a later development. And of these 5 that we prioritized initially, I will show you which ones we are going to execute in this second semester of 2019 and which ones will be left for later. We are going to execute the first 3, which are Usme, Bosa, and Santa Clara, and the new Maternal and Children's Institute and the Simón Bolívar Hospital. We do have the documentation to structure the project, and we will leave it for later tender process in the coming years. We start with the hospital project of Usme then. This is the topics that we're going to cover briefly to give you a summary of the content of the project. First off, we see the need to satisfy different requirements. Usme is a very important location of Bogota with more than 430,000 inhabitants, but they don't have any public or private offer for medium and high complexity hospitals, so there's a lack of supply here. This is the most fragmented and most isolated location of the city because it's in the southern region and it's not connected to the central areas. And there's an important characteristic, which are demographic rates, the highest demographic rates in the district. We have fertility, birth rate, and migration. We have the comparison of the rate of the location together with the rate of the district, and we can see that all indicators, we see that the location rates are higher than the average rates of the district. This means that we need specifically more supply in maternity services because of the growth of the population and the number of birth rates, and this is the purpose of this project. And of course, we have a deficit of about 200 beds in the city, in this part of the city. We already have the land available, the site or the place where we're going to build the project. You can see an air view of the lot. They also have good access through this road. It's called Autopista El Llano, which is a main road, and it's located just in front of the location of the hospital. So, in terms of road access, we can ensure users and professionals to arrive at the hospital institution. These are the limits of the lot or the plot of land that we have available. This is part of a development plan of the city, which is called Plan Parcial Tres Quebradas, which is an urbanistic plan towards the southern region of the city. We also have an area of 32,000 square meters in total, and our construction area would cover about 33,000 square meters, with a hospital that is going to have 221 beds in total. And we estimate to benefit about 360,000 people. So these would be the most relevant figures of the project. Right now, we have already closed off the technical aspects of the study to implement the project. This means that we have supply and demand. We also have the urban architectural analysis and the study of the deeds of the property. We also have the architectural medical program, and we have a design blueprint, and we also have an equipment matrix. Because these hospital projects don't just include the construction, but also the provisioning of the hospital. So as of today, we have already defined the technical aspects necessary for the execution of this project. Here is the service portfolio to be provided by this hospital. It'll have 31 intensive care unit beds, 31 of intermediate care, 78 for obstetrics and gynecology, because of the maternity and children's profile of the hospital, 60 pediatrics beds, 21 for neonatal and basic care beds, for a total of 221 beds in this hospital project. We will have 4 surgery facilities, 30 urgency emergency beds, and we will have magnetic resonance equipment, X-ray, computer X-rays, endoscopy equipment. So this is going to be fully equipped for a high complexity hospital with top-notch equipment for the provision of proper health services. Here we have the numbers that we have for this project. Considering that this is a project that includes the design, the construction, and the provision of the hospital. Of course, we have the auditing process of the processes of the project as well. There are funds for the purchase of the property that is already completed now, and this gives us a total of 290 million Colombian pesos. That in dollars we would be talking about $93 million for the total cost of this hospital project in Usme. The contracting method that we have defined for this project specifically, this is a key-in-hand contract, so to say, that basically includes the elements that you see on the slide. This means the detailed designs of the hospital, we provide a medical and architectural program, and we provide a design blueprint. But the final design will have to be adopted by the contractor according to the elements and the guides that we provide. Of course, the contractor needs to build the infrastructure completely, as well as the provisioning of the medical equipment, specifically in diagnostics aids and the necessary equipment for the provision of the services. It also includes the clinical and administrative furniture. This means the beds, the places for visitors, waiting rooms, and so on. All the furniture involved is also included in a hand-in-key contract, where the contractor at the end of the process will have to provide to the hospital in working conditions. And this is our schedule for the project. Since we already have the technical aspects completed, we are reviewing the legal documents right now in these coming days, and we want to open up for tender for the design, construction, and provisioning process, as well as the auditing process in July this year. And according to our schedule, the award of the tender would be by the end of October this year, so that we can sign the contracts in November this year. Our schedule for work establishes that the hospital would be completed by December 2022, so that we can start providing services in 2023. So now we are going to talk about the second project, which is in the San Juan de Dios hospital compound. These are the same topics that we're going to cover, just like in the other project. This project intends to replace a hospital that we have right now, which is called the Santa Clara Hospital. But this is a hospital that was built in the 40s. And in the 40s, in the last century, actually. So given the constructions, it doesn't fulfill the seismic resistance regulations, but it's also a conservation property, and therefore it's very complicated to intervene in this project, and it doesn't have the sufficient space to expand the services. So what we want to do is to replace the current Santa Clara hospital and replace it for a completely new hospital in a different site than the one that Santa Clara is located in right now. We do see an air view here of the location of our San Juan de Dios project. This is a plot of land that covers several buildings, and the entire plot of land covers more than 100,000 square meters, so that you can have an idea of the size of the plot. But the hospital project specifically will be built in this area here, where we have a central tower where the previous San Juan de Dios hospital used to be in. Today, the tower is empty and the hospital is not in use. And this building would be completely demolished and we would build a new hospital in this location here. We also have some properties around it which are conservation properties because of their architectural components, and they are going to remain here in this location. But the project is just going to include a new building in this site, and in this plot of land behind, which is a free area, we will have a tower of outpatient offices. So this is one project. It includes two buildings, the hospital, and back here we have an area for consultation offices. We call it a CAPS, which is a priority health center that provides outpatient consultations. And the project also includes a pedestrian walkway so that we can connect the pedestrian path between the two sectors. This hospital will have 312 beds and 50 emergency stretchers because, in addition to being the most important hospital in this area of the city, it'll also have an ICU. This means the emergency services will also be provided in this institution. We also have an area available for this construction of 28,000 square meters for both constructions, and the idea is to build 84,000 square meters because we would be adding a parking lot spaces, basement parking lots beneath La Alameda, and which is also included in the project. So the basements and the parking lots plus the building will give us a total of 84,000 square meters to be built. And we hope to benefit 360,000 people with this project. Here we can see the different buildings that we saw in the air view that I showed you previously, and we are going to point out the buildings that are going to be demolished and which would be the new ones that are going to be built. The ones in red are buildings that we're going to demolish. The central tower, which is the one that you see here, we have to demolish it. And we have a space here of an old building in front of this heritage building, which will also be demolished, and another space for the office building here. So in replacement of these demolitions, we are going to build a new Santa Clara hospital, which would be a completely new hospital building. And we have reserved the space so that in the future we can have the maternity and children's entity with a free space with a soccer area. This hospital is not included in the project, but it's foreseen for future developments. And the third one would be the CAPS, which would be the outpatient office building. That is included in the project and is included in the contract. And the fourth building would be La Alameda, which is just a pedestrian walkway so that we can connect both sectors. That is also included in the cost of the project and in the requirements for the contractors. So number one, it would be the Santa Clara Hospital, right? Number three, it would be the outpatient office building. And number four, La Alameda. This is what is included in the project, and what we have for the project would be number two, which is the Maternity and Children Services Hospital. As for the progress, we have already completed all technical studies. It's very important for us to look at seismic resistance studies for the current tower. That was the first decision that we made, and we had to decide if we would reactivate the building or build a new one. We contracted the study, and the conclusion of the study is that it's the same or even more expensive to reinforce the structure than to build a completely new building. So we opted for demolishing and building a completely new hospital. In this project, we also have the medical architectural program, the equipment matrix, and all the legal authorizations to start the project. This is the description of the service portfolio. This is a hospital that is a bit larger than the first one. We have 312 beds. We will have 136 beds for internal medicine. This is mainly focused on chronic patients. We will have 119 surgical beds for a total of 255 in the hospital section, and we will have 35 intensive care units and 22 intermediate care units. So this is a hospital that is focused on chronic patients, and of course, with a relevant presence in intensive care issues, and also for surgical rooms, we will have 7 surgical rooms in total. As for diagnostics aid, this also includes the equipment. We have high technology equipment, MRI, we will have angiographs, we will have cutting edge equipment so that we can provide the proper provision of the services. And here we have the figures of the project. We have estimated 325 million pesos for the construction, and this will give us a capex of 406 million. And we will see now that in this project, different from the one in Usme that we saw before, we will also include a maintenance component for 5 years. This will include maintenance of the infrastructure and the equipment, in addition to surveillance and cleaning services during this period of time. This will add 101 million pesos for a total investment of 507 million pesos. That would be about $163 million in terms of the investment for this Santa Clara Hospital in the San Juan de Dios Hospital compound. As I told you before, what does this contract include? It includes, of course, the detailed designs. Just as the one before, we also provide with technical and medical studies, some blueprints and guidelines, but the final design or the detailed design will be under the responsibility of the contractor. And of course, the construction, the provision of the medical equipment and the clinical furniture. Up to these 3 first items, it'll be the same as the previous Usme project. The difference here would be these 2 additional items that include maintenance of the site and the equipment for 5 years, and cleaning and surveillance services for 5 years. So this is a project that includes some PPP elements, even though in the strict sense of it, it's not a PPP as such, because us or the public sector will be paying off for the cost of the infrastructure as we progress in the work and as we complete some milestones agreed on with the contractor. Our schedule, just like the previous one, since we already completed the technical aspects and we are just refining the legal documents, the tender would be opened up for July, both for the auditing process as well as for the tender process as such, so that we can award the tender in October and we can sign the contract in November, according to the schedule that we have set out for this project. And this would be the final project, which is the Bosa Hospital. This is a public-private partnership, 100%. We will see what it includes. This is the table of contents, the same as the previous projects. In this case, in this area, we do have a working hospital that is called the second level Bosa Hospital, but it's a hospital whose infrastructure conditions, as you can see here, are not sufficient, and specifically, the supply of hospital beds is quite limited in comparison to the needs that we have. This hospital has 60 beds, but in inappropriate conditions, and it doesn't have the option for growth either towards other sectors. So we do need to replace it completely for a new hospital. Here we have identified the plot of land already. The plot of land has very good characteristics, specifically because you can see that it's a plot of land that has access on four sides, and this plot of land was reserved for many years already precisely for hospital constructions and equipment. So this is part of the new development of the city in this area, and the plot of land is reserved specifically to build a hospital in here. This hospital will have 215 beds, which is similar to the one in Usme. The plot has an available area of 19,000 square meters, which is enough for the needs that we have. We also have a construction area of about 30,000 square meters, and we hope to benefit 411,000 people. Just like in the other projects, the technical aspects have already been defined and completed. Of course, we have a supply and demand study, the urban architectural analysis, a medical architectural program, a design blueprint, the equipment matrix, and also we are working with the planning authorities in the city, and for this we have the implementation plan that allows us to build the hospital in the city. All of this is already completed and defined. The service portfolio of this hospital is also focused, as in the previous Santa Clara project, is focused on chronic patients. So we are going to have 135 beds for internal medicine, 60 surgical beds for a total of 195 hospital beds. We will also have 12 adult intensive care units and 8 adult intermediate care units. That gives us a total of 215 beds for this hospital project. Here we have some numbers in terms of the construction amounts and provision amounts. Construction 173 million, equipment or provision 59 million, for a total capex of 232 million and an opex of 16 million pesos, approximately $5 million. These numbers will then become an annual rate, which is a future amount, because as you remember, since it's a PPP model, the hospital will pay according to the availability of the service and the quality standards, and it'll have an indefinite term in the operational side. That means that once the hospital is built, it'll have 15 years and a total term of the contract of 18 years. That of course includes the design and the construction as we have foreseen it right now. This is the description of what this PPP contract includes. Of course, it includes the detailed design, just like the previous ones. It includes the construction. It includes the provision of medical equipment, clinical and administrative furniture, just like the ones before. It also includes maintenance of the worksite and the equipment. In this case, it'll be for 15 years, which is the operational term foreseen for this project. And during this time, it also includes the replacement of equipment and furniture. This means that the contractor will not just be in charge of the maintenance of the infrastructure and the equipment, but many of the equipment will be replaced during the execution of the contract, because our study shows that the average shelf life of these equipment would be at 8 to 10 years approximately. But based on this time, this is how we're working. And this means that the contractor will have to replace the equipment to provide cutting edge equipment or with more modern technologies when it's necessary to replace them. And as for the administrative aspects, it includes cleaning services, disinfection, and surveillance services. These would be part of the responsibilities of the contractor in this PPP model. In this process, it's important to point out that specifically for the Bosa hospital, right now, we are going through the pre-selection of the stakeholders or the interested parties. Right now, I will show you a link where you can have access to this information. In Colombia, these contractual processes are published on a procurement website of the state known as SECOP. So the documentation regarding to the pre-selection process is already uploaded there. It started in April 30 already, and there is a term to submit interest statements of interest, and it'll expire on June 28th. That means in the coming days. And this would be the final date for the companies that are interested would show interest in submitting to tender. It's important that the conclusion of this pre-selection process would be the preparation of a list of companies or intentions to participate in the tender that fulfill the requirements known as enabling requirements, specifically in terms of the financial aspects, the accreditation of experience in construction, and of course, in the legal documentation that is required for the processes. After the pre-selection process, and once we have defined the list of companies that would be participating in the tender process, the tender process will start in August 2019, and we would be awarding the projects in November or at the beginning of December 2019 at the latest. And then we will continue with the signing of the contract in December this year or at the beginning of 2020 at the latest. We also foresee to complete the hospitals for December 2022 or the beginning of 2023, where the operational phase of this project would then start. Here, we have a link that will take you directly to SECOP, where you can see the pre-selection process documentation. We also have to say that if you enter this link, you will find in SECOP an additional link that will take you to the data or information room of the project, where we have included more than 120 documents in total with all the studies that I just mentioned regarding the medical architectural program, the soil studies, topographic studies, and whatnot. This means the reference documentation for the project that is also accessible right now for all stakeholders. I'm not sure if this link can be copied. Well, the information will be available anyway so that you can have access to it. In addition to this, I wanted to tell you about some email addresses that you can submit observations to in relation to the pre-selection process, and a second email address where the interested parties can establish one-on-one meetings with the structuring team of the project. So the first email address would be contratación at saludcapital.gov.co, right? GOB would be with a small v. In this email address, the email would be contratación at saludcapital.gov.co. That would be to submit questions about the process and the documents included in SECOP and in the data room. And the other email, hospitalbosa at fdn.com.co, is to request individual meetings with the structuring team. Great. So these two email addresses are available so that you can make use of them. The first one would be to submit questions about the pre-selection process, and the second one to obtain one-on-one meetings with the structuring team of this project. So we want to thank you for your participation, for being here today. We hope that you show interest in these projects. We have structured them with the highest professional rigorousness. These efforts have been in the documentary construction for more than 2 years. Right now, we are in the preparing the tender process to be able to award them in 2019. Thank you very much. Thank you,
Algunas
Alfredo.
preguntas en el
I
chat.
think that we have some questions from our chat window.
En la diapositiva donde se mostró
In the
los
slide
OPEX,
where you showed the
en el caso del
OPEX,
proyecto de
in the
Bosa,
case of the Bosa project,
adicionalmente
in
la
addition,
reposición, bueno, que si el OPEX es anual, tiene la
is the
impresión.
OPEX
El
an
OPEX que estamos
annual
usando es
number? That's
anual.
the question.
El OPEX es anual, el
Yes, the OPEX
anual.
is
Adicionalmente, la
annual
reposición de los
operating
equipos,
expenses.
¿en
In
cuánto
addition, the
está
replacement
incluyendo
of the equipment is the amount
la reposición de los
in
equipos está incluyendo en el CAPEX
the
o en el
replacement of
OPEX?
the equipment, is it included in the capex or the opex of the project?
En el
That
OPEX,
one is included in the opex
se
of the
incluye la
project.
reposición.
We do include replacement of the
Otro
equipment in the
panelista
opex.
me consulta,
Another panelist is
dado que
asking,
aún no se han respondido algunas
given that
observaciones
some
al proceso de
observations to the
precalificación,
pre-selection process
¿están
have not been
considerando
yet
ampliar el
responded,
plazo?
have you considered of extending the term?
Nosotros ya
We
respondimos todas las
already
preguntas
answered
que se
to
hicieron
all the
hasta
questions
el momento
submitted
que
up to the
presentaron
moment
para presentar
of
los
expiration
cálculos.
of the term
Los
to submit
cálculos
observations.
pueden seguir llegando
However,
observaciones.
you can
Las
continue
vamos a
to send in
responder todas.
observations and we are going to
Y
answer them all.
obviamente a partir de las observaciones que
And of
tengamos ya
course,
pendientes de la realización
we
de
still need to
publicar, digamos, un aviso de
publish
revocatorio
a modifying notice
al proyecto
for the
y en
project.
este momento pues
And
no
right
hemos
now,
considerado
we have
la
not
ampliación del
considered
plazo.
extending the term.
Nosotros iniciamos la
We
publicación de esta
started
precalificación el 30 de
to
abril
publish this
y estamos
pre-selection
para el
process
28
on
de
April
junio
30th,
para que
and by
tengamos
June
2 meses
28th, 2 months would have
de
probably gone by
iniciamos el
from the
proceso de
moment
desarrollo
when
documentario.
we started the process
También
and
es
made the documents
importante
available. It's
mencionar
also important to mention
hemos
that
recibido una
we
gran
have
cantidad de
received a
preguntas,
large number of
pero
questions,
no
but
tenemos
we
alguna
do not
solicitud que implique
have questions that are
una
related to
modificación de forma
a
sustancial
substantial modification to the pre-selection process.
El cuarto de datos
The data
precalificación
room
solo aplica
in
para
the
el proyecto de
pre-selection
Bosa.
process, does it only apply for the Bosa project?
cuarto de datos
Yes,
es
the data
exclusivo
room is
del
exclusively
proyecto de
for the
Bosa.
Bosa project. We have to take into account that every hospital project will have an independent tender process
Con una información propia
with
de cada proyecto.
information of
No se pueden confundir, la información es
each
específica
hospital
para cada
process.
proyecto.
So please don't get confused. The information belongs specifically to each project.
Acá nos consultan.
There's another question here.
Señores, de manera atenta solicitamos los informes
We
del
would
estado de
like
eficiencias
you to
futuras
tell
para el
us
inicio de las
the
licitaciones de cada uno de los
condition of
proyectos.
future validities that can allow us to start each of the
Los
3
proyectos de
projects.
Usme,
The projects in
Clara,
Usme and Santa
las
Clara,
vigencias futuras se
the
encuentran
future
aprobadas.
validities are already approved through the Council of Bogota, Agreement 713 of 2018 and 725 of 2018, so that they do have the resources. And in the Bosa project, we would be filing it on June 17. We have already defined the resources or the funds, and we have agreed on the amounts with the Ministry of Treasury. And consequently, before opening the tender process, we have already our future funds approved that would financially back up the project.
Para el proyecto de Bosa,
For the Bosa project, considering that the health service is not offered by the concessionaire, how can you mitigate these risks?
En el proyecto de Bosa,
Well, in the Bosa project,
la responsabilidad
the
del
responsibility of the contractor
obviamente tiene que ver con la
is
disponibilidad de la infraestructura.
related to the availability of the infrastructure, equipment, surveillance and cleaning, maintenance as well, but that contractor doesn't have any
La prestación del servicio
interference in the provision of the health services. The provision of health services would be provided specifically by the public sector. From this perspective, the risk, that means the risk of the use of services, how much the services are used or not, the facilities and the equipment, that would be a risk that is retained in the public sector, within the public sector, and the contractor just needs to maintain the infrastructure and the equipment in perfect conditions. If they are available, we would generate the payment. So the contractor, from that perspective, would be isolated from the demand risk that is taken by the public sector. So, in a way, this is a gray-green equipment because it includes equipment, but it's not a white gown project because it does not include health services on the hand of the contractor. So the contractor does not have any interference and they don't need to provide with medical staff or nursery staff or anything like that to ensure the health services.
Buenos días, nos gustaría
Good
que
morning.
aclararan en
Could you
términos de
please
participación de
clarify
reales en
the
el proceso de la
participation of
reconstrucción
plural
del
structures in the PPP project for the Bosa Hospital? Well, in these situations, we cannot go into details or discuss specific aspects regarding to the pre-selection because we have a specific roadmap for that, which are the observations given to the project, and we respond officially. I would just say that first, that we do allow plural structures. The document says it, and the condition of these plural structures are clearly described in the pre-selection process as well. So we kindly ask you to refer to this document, and if there's a specific question, you can send it to us in written form to the email that we just gave out, and we will also give you the answer in writing, and we will publish it in SECOP so that all interested parties can also learn about the response. About the Bosa project, when are you going to release the appendices of the contract? We still need to publish in the data room. We still need to publish the appendices in the data room. And we need to specify that this data room information serves just as a reference without prejudice to the information that is later on made available in the tender process. And we believe that in the coming days, we would be publishing information related to the technical appendices in the data room that we have foreseen for the contract. Of course, we need to make sure that all information published in the data room right now in the pre-selection process serves just a reference, while the information contained in SECOP, that is the information that strictly governs the pre-selection process. When would they be available in the data room for the other two projects? The other two projects, that means Usme and Santa Clara, are not going to have a pre-selection process. This is an important aspect because the Colombian law doesn't allow us to go through a pre-selection, but only in the cases of PPPs or projects that have international rules. And therefore, as soon as we open up the tender process, we will have pre-specifications with the technical information of the project at once so that we can receive observations by the interested parties. But we open up the tender process directly without the previous pre-selection process. In relation to the gowns question and the risk of interface, if the use of the equipment has higher damage, who would take on these costs? In REPEX, for example, we are not going to go into details here either, but we have foreseen to assign risks between the public and the private sector. And the contractor has to ensure the availability of the equipment and of the infrastructure in 100%. And secondly, the responsibility in the provision of health services would fall exclusively on the public sector. we would probably have to review in each case
las circunstancias
the
específicas
specific
de
situations
esto que produce, digamos,
if
algún mal funcionamiento
there
del equipamiento del
is
equipo.
a malfunction of the
Igual pasa
equipment or
nosotros
damage to the equipment.
tenemos esta
However,
información
we do have
del
information
estándar de uso
regarding to the standard of
o el
use
estimado de uso
or
para los
the
dispositivos
estimated use
o
of the
dispositivos
equipment
que
as well as the
hagan
infrastructure
referencia de los
that will
contratistas.
serve as reference for the contractors. What is the horizon of the complete schedule for the Bosa hospital? This means, when do you expect to open the tender process and publish the corresponding documents?
Habíamos señalado que
I
en
think that we
julio
mentioned this already. In August
de este año
this
se
year,
refiere a
we
la
will open up the tender process. In Bosa, the equipment provider, should they be part of the SPB or the proposing party?
referimos también al
We
documento
also
de
need to refer
precalificación.
to the pre-selection process
En
here.
resumen,
And
estamos pidiendo
in summary, we
cotizaciones
are
de tipo financiero,
asking financial conditions, asking for financial conditions, experience in the construction of hospitals, experience in investments, and legal documents. So the requirements, the enabling requirements, are just the ones that are included in the pre-selection process. So we kindly ask you to refer to the requirements published in there. I don't think we have more questions in the chat room. We are going to repeat the email addresses because there are many questions about that. The first email address for questions about the process and documents included in SECOP and the data room would be contratacion@saludcapital.gov.co. And the email to ask for one-on-one meetings with the structuring team is hospitalbosa@ftn.com.co. We want to remind you that this seminar is being recorded. In the website of ProColombia, we are going to upload the video and the presentation in English and Spanish. The link will be sent via email through the advisor of ProColombia to each of the companies. I think that we have another question here. They're asking, can you please explain the selection process for the Usme and Santa Clara hospitals? I don't think that would be open yet. We only have Bosa for now. Yes, they're not open right now. In July, we do foresee to open up both tender processes. Can you tell us exactly where we can have the medical equipment matrix? Is there a link? The specific information for Bosa will be uploaded in the data room where we will incorporate these elements, including the equipment matrix. I think that the other question was related to the pre-selection question and the extension of the term, but I think that we already answered this question. Thank you very much for your participation. We will be sending you the information via email. I give the floor to Gonzalo Vargas, Investment Manager for the region. First of all, thank you very much for your presentation today. This information has been very important for us. It has added value for us, and we have had many questions from our offices and our businessmen. Thank you very much. ProColombia is your home. Thank you to Invest in Bogota, and for all of you, all the businessmen and all the offices, please keep asking us questions. Please contact our advisors, contact our managers, so that we can help you throughout this process. I wish you a great day and afternoon to you all.